Coming through. Scene is safe. Hey, are you listening to me? He's not responding. There's no circumstantial evidence of drug abuse or poisoning. Somebody activate the emergency response system and get an AED. He's not breathing. There's no pulse. Start CPR. 1, 2, 3, 4.
Priority of any rescuer when he reaches the site is to make sure that the scene is safe so that there is no threat to the rescuer at the scene.
Coming through. Scene is safe.
The next step is to assess the victim for response and breathing. If you are the lone rescuer, then you should immediately call for help and get AED. During scene safety, circumstantial evidence of drug abuse or opioid toxicity should be looked into, and early administration of appropriate antidote should be ensured.
There is no circumstantial evidence of drug abuse or poisoning.
Assess the victim for a response.
Hey, are you listening to me?
And if there is no response, shout loudly for a nearby help or activate the emergency response system using mobile device if appropriate, or send someone to get an AED or defibrillator and emergency equipment.
Somebody please activate the emergency response system and get an AED.
This has different meaning in different situations. For example, if a victim has cardiac arrest within a healthcare facility, you are going to call for the code blue team or rapid response team. If you are outside the healthcare facility, you can call nearby ambulance service or nearby hospital. In some states in India, there is a number to call for emergency response, example 112 or 108. Look for normal breathing and carotid pulse simultaneously as the person who is performing the chest compression is sitting by the side of the victim. It is easier for him to feel the pulse. Using 2 to 3 fingers, you can locate the pulse. You can feel the pulse by sliding these fingers in the groove between the muscles at the side of the neck to determine the next appropriate action. Breathing and pulse check should not take more than 10 seconds. Next action will depend on victim's situation. If breathing is normal and pulse is present, monitor the victim till emergency help arrives or victim is taken to the hospital. If there is no normal breathing but pulse is present, provide rescue breaths. If there is no breathing or no normal breathing and no pulse within 10 seconds, begin high quality CPR with cycles of chest compressions and breaths in 30:2 ratio, starting with chest compressions using the CAB sequence.
He's not breathing. There's no pulse. Start CPR. 1, 2, 3, 4.